Hello, my name is Frances Angela C. Icot, your student nurse for today. I will be performing the return demonstration for bed making with an occupied bed. First, I'm going to check the patient's chart for any limitations in physical activity, to determine their level of activity, facilitate their cooperation, and ensure the patient's safety. Next, I will assemble the equipment and arrange them on the bedside chair in order in which the items will be used so that everything is organized. Now, I will perform hand hygiene to prevent the spread of microorganisms. Good morning, ma'am. My name is Frances Angela C. Icot, your student nurse for today. May I please know your full name? Okay, your birthday? May I please check your ID band for verification, please? So for today, I will be making your bed while you remain lying down. Rest assured that this will only take a while. Identifying the patient helps verify the correct patient and procedure. And explaining the procedure to the patient helps alleviate their anxiety and helps them prepare for what to expect. Right, now I'm going to close the curtains around your bed and the door to the room for your privacy. Right? Next, may I please adjust your bed height, please? Okay, I will lower your bed height in a comfortable working position, which is in my elbow height, so that I can prevent any back and muscle strain. And then I will lower your side rail, but keep the opposite side rail raised for your safety. And then I will place the bed mattress in a flat position so that I can make it easier to prepare a wrinkle-free bed. However, since the bed is already in a flat position, we can keep it as it is. Okay. Now I will put on my gloves to prevent the spread of microorganisms. Then I will check the bed for any personal items that to prevent them from being misplaced or lost. You don't seem to have any items on your bed. And then I will disconnect the call bell and any tubes or drains to prevent discomfort and any accidental dislodgement. Alright. Now, if possible and available, we will shift the mattress toward the head of bed to provide more foot-room for the patient and improve their comfort. However, since there is no assistance available, we will keep it as it is. Now I will put this back blanket over you to provide you warmth and privacy. Please hold on to it. While I try to remove the top linen underneath. I will fold any linens that will be reused and place them in a clean chair and place any soiled linens directly into the laundry bag to prevent contamination and the spread of microorganisms. Now I will assist you in turning over to the opposite side. Okay, I will now move you 1, 2, 3. Then reposition your pillow and your back blanket so that it can be easier to move to the other side. Then I will loosen and unfold the soiled linens as close to the patient's body as possible so that it can be easier to remove and turn to the other side. Then I will place the clean bottom sheets on the vacant side of the bed. Then fan fold them towards the center. Place them underneath the old linens. Then secure them safely so that we can reduce the spread of microorganisms and make it easier to remove the wrinkles. Right. Now, if needed, I will place a draw sheet and a protective pad so that they can be easily changed when soiled. And can help assist with repositioning. Fan fold it to the center. Place it underneath. Then secure them safely and tightly. Right. And the protective pad. Fan fold. Now, I will raise the side rail. Then I will move you towards. I will move you and the folded linen towards me. Okay, I'll move you now. 1, 2, 3. Reposition your back blanket for while maintaining your privacy and comfort, and your pillow. And then move to the other side of the bed, and then lower the side rail to promote warmth, privacy, comfort, and safety. Now I will loosen and remove the remaining soiled linens and place them directly into the laundry bag to prevent contamination and the spread of microorganisms. Pull the clean bottom sheets protective pad and the draw sheet and secure them tightly to remove wrinkles and prevent discomfort and skin irritation. Protective pad. Now, I will assist you to return to the center. 1, 2, 3. Right. And then I will take your pillow and change the pillowcase without shaking the linen so that We can prevent the microorganisms from spreading to the air. I will put it back on your head, under your head. And then I will place another top blanket over you. Please hold on to it. While I remove the bath blanket underneath, secure them tightly at the foot of the bed. And we will miter it. I will loosen it around your foot so that it can be easier to move and provide you more comfort. Right. Now I will help you to a comfortable position. Right. And then remove my gloves. I will raise your side rail and lower your bed height, and then and reattach the cowl bell, and then I will place any soiled linens directly into the laundry bag, and to prevent any infection transmission and promote you safe, comfort, and privacy. Are you comfortable, or do you need any adjustments? Okay. Thank you for your cooperation. Hello, my name is Frances Angela C. Eagle, your student nurse for today. I will be performing the return demonstration for bed making with an unoccupied bed. First, I will assemble the equipment and arrange them on the bedside chair in order in which the items will be used so that everything will be organized. And then, I will perform hand hygiene to prevent the spread of microorganisms. Then, I will adjust the bed height and raise it to a comfortable working height, which is my elbow height, so that I can prevent back and muscle strain. Then I will lower the side rail. Then I will disconnect the cowl bell and any tubes or drains from the bed linens to prevent any damages to these devices. Then I will put on my gloves now to prevent the spread of microorganisms. And then I will loosen all linens from head to toe systematically so that I can reduce strain and prevent tugging or tearing of the linens. Right. I will fold any linens that will be reused and place them on a clean chair to reduce strain and save time and energy. And I will place any soiled linens inside the bottom sheet and then place them on the laundry bag directly so that we can prevent contamination and the spread of microorganisms. If possible, I will shift the mattress toward the head of bed to provide more fulcrum for the patient and improve their comfort. And then, if the bed is soiled, I will clean it and dry it before applying any new mattresses. Right? I will now remove my gloves. And then I will place a new mattress, a clean bottom sheet, evenly. And then unfold it. Unfold it to the center. To diminish any spread of microorganisms and reduce strain and provide enough coverage for the mattress. And if possible and needed, I will place a draw sheet and protective pad under the patient's midsection so that and unfold it in the center so that they can be easily changed when soiled and assist with repositioning. Right. Now I will secure the corners of the bottom sheet from head to toe. On the near side, to reduce strain. Then move to the other side. And then I will place a top blanket or sheet with the upper edge 6 inches from the top. Prevent shaking linens. And then we will tuck the foot of the bed, and then miter the corners so that from the near side first, so that we can reduce strain and keep them in place. And then we will create a cuff by folding the upper edges, folding the upper 6 inches of the top blanket to provide more comfort and privacy and allow easier access for the patient. Then we will do the same procedure to the other side. Then measure the corners. Then create a cuff. And then we will change the pillowcase and avoid shaking it, avoid shaking the linens, so that we can prevent the microorganisms from spreading through the air. We will high fold or fan fold the upper edges, provide more comfort and privacy for the patient. Right, other side. And then, right, and then we will now disconnect the coil bell and then adjust the bed height, and then raise the side wheel. And then I will place any soiled linens directly into the laundry bag to prevent any spread of microorganisms, and then I will perform hand hygiene to prevent any infection transmission and the spread of microorganisms. Thank you for watching.